At what point do growing pains cross the line into something more serious? A lot of aches in childhood are dismissed or ignored altogether, assuming kids will get over it in a day or two. Unfortunately, this common belief can be dangerous for kids experiencing chronic pain. Last week, we discussed why understanding pain is crucial for proper treatment, which is why there's been a growing push to educate the public on pain function and management. Dr. Tonya Palermo, a professor of anesthesia and pain medicine at the University of Washington School of Medicine, says pain education is so much more important than most people realize.
So what pain science education really does is it really provides that understanding of, in particular, pain that persists. What are all the different processes? How can someone take more agency in being a part of the solution? And no matter what treatment someone is being offered, that education is the springboard for having them feel empowered to engage in that treatment, whether it's physical therapy, whether it's psychological treatments. So that educational piece is so important that there has been a lot of attention around, how do we not just give people information, but how do they actually learn it in a deeper way so that they can provide and construct some solutions for themselves, and again, being better empowered and being able to work with their healthcare providers.
Palermo also directs the Center for Child Health Behavior and Development at Seattle Children's Research Institute. She says this concept is especially important when it comes to childhood pain.
I think in childhood in particular, what we worry about are a couple things. One is pain's often hidden, and this is across the lifespan, but particularly in children, we worry because they can be more easily dismissed. They don't have the verbal skills or autonomy that adults have in communicating with healthcare providers. Children's pain is often invalidated. There's a misperception that children are healthy and shouldn't have persistent pain. There were some unfortunate terms used previously, like growing pains, that implied that children should grow out of pain and should not have, this level of maybe intensity of pain in childhood. So there's been, unfortunately, a poor kind of history of children's pain being ignored.
This choice to overlook or underestimate a child's pain can be detrimental. Research shows that chronic pain during childhood often follows that person throughout their life.
This is both a continuation of the same pain that they had in childhood for over half of children. But it also, for some children, their pain resolves, but the risk factors are still there. And there may be a later point in adulthood where there's an emergence of chronic pain again.
In addition to the hardships that come with dealing with pain on a daily basis, Palermo says that this experience as a kid can have profound socioeconomic impacts later in life.
Children who grew up with chronic pain are less likely to have a college degree, actually less likely to have a high school diploma. They're more likely to have what we call kind of short-term non-benefit positions as jobs. So there are real continued impairments that can continue into later adult life that affect social mobility and economic status in adulthood.
Which is why it's so important to properly educate parents and kids about pain to minimize these downstream risks. And though this education has been around for decades, recent studies show that medical professionals need to include more of the common teaching principles to increase its effectiveness.
We know just giving people information doesn't change your behavior. I mean, you can give someone a handout about what they should be eating in terms of trying to encourage them to lose weight. We know that doesn't work. And the same's true for pain. You can't just hand someone a flyer giving them facts about pain. So you need to have it be more active of a learning process. And so there's been a lot of movement more recently to take some educational psychology principles around really having someone be more active in learning. And this is usually not done in one time point only. It needs to be repeated. And the learner, in this case, it's more complex because it's the parent and the child, and they both need to get there in their own way just to understand chronic pain so that they can both be active participants.
Along with active learning, research is showing that peer interaction can be a helpful tool in making sure this knowledge is fully understood. But despite the growing body of literature and evidence in favor of these techniques, Palermo says it's underutilized. To start, she says that we should be much better at identifying kids who need treatment.
In the space of identification, we need to make better use of our ability to identify children from electronic medical records who have certain risk factors. Again, we know some of the vulnerabilities. We know that having anxiety and depressive symptoms, having certain social and family factors, certain history in early life of stress or pain are really important predictors of the likelihood of having chronic pain in childhood. We could use a lot of the AI large data kind of predictive models and better identify children from their visits to primary care and specialty care providers and flag providers and alert them to the fact that this child's probably at risk and needs to be screened and types of treatments that could be considered.
But even if we start utilizing technology to increase this early screening, there's still an issue of treatment access.
Pain programs are extraordinarily limited for pediatric populations. There's about 55 in the entire US. So that means most states have one pediatric pain program that's interdisciplinary and can treat complex chronic pain. So the vast majority of children with chronic pain do not receive that level of care.
And instead of putting a bunch of money into building more facilities, Palermo thinks an easier option would be to shift this care away from a clinical setting to more accessible options like telehealth.
We can scale things and make them accessible in the home. We can also be more creative about community assets that we can tap into, whether it's through schools, whether it's through other community-based organizations and programs where, in the case of kids, where kids are. And how can we then, use a better range of services so that, again, it shifts it away so it's not all based in clinics that don't have the capacity to see the number of children and families who need this type of care.
As we wait on these improvements, we can capitalize on the current resources available to take control of our own health and treatment. Seattle Children's Pediatric Pain and Sleep Innovation Lab offers a mobile app called WebMap Mobile that provides pain management and education resources. You can find more information about Dr. Tonya Palermo and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.